Welcome to another episode of Hudson Health. My name is Dr. E.J. Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJBarnabas Health. I have with me today my co-host, Dr. Angel Lazo.
Hi, my name is Dr. Angel Lazo, and I'm with RWJBarnabas Health at Exchange Place in internal medicine. So today we have a very interesting segment, talk about, once again, about women's health.
Absolutely. Dr. Rebecca Yang was just a brilliant breast surgeon, recently joined us here at Jersey City Medical Center and RWJBarnabas Health, is going to talk to us about all things breast health, from screening, diagnosis, the Comprehensive Breast Cancer Center, and just what women need to know to take better care of their health.
Yeah, and again, I mean, she's going to cover basically all the basics, you know, it's like you said, as far as screening, the importance of self-health screening, women's health.
Yes, absolutely.
Exercise, recuperation, I mean, the whole gamut as far as breast cancer and breast disease. So very excited to have her. She's going to even talk about some of the affiliations that we have with the National Cancer Institute, et cetera, et cetera. So which is a really big deal, especially for Hudson County.
Absolutely. The only certified cancer institute in New Jersey. She's a wealth of knowledge, and really excited to have her on the show and delve into all things breast health.
All right. Well, we're going to take a break and we'll be right back.
Jersey City Medical Center is healing, enhancing, and investing in Hudson County because your heart doesn't beat just for you. So get it checked. When your bones are healthy, it lifts us all. We're delivering joy daily in our Lord Abbott Maternity Wing and providing New Jersey's only NCI-designated comprehensive cancer center. We'll continue building our medical network and taking every precaution for your safety so that we can all be healthy together.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Hi, everyone, and welcome back to Hudson Health. My name is Dr. Angel Lazo, and I'm with RWJBarnabas Health, and I'm here with my co-host, Dr. Akunyili.
Welcome back, everyone. I'm Dr. E.J. Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJBarnabas Health. And today we're going to have with us a Director of Breast Surgery at Jersey City and part of our Cancer Institute of New Jersey network, the only comprehensive cancer center in New Jersey. Very proud of that, Dr. Rebecca Yang. She is just going to be a wealth of knowledge. We are going to talk about comprehensive breast health program.
Yeah, and again, we're going to encompass everything. I think Hudson County is going to see actually the passion that she brings, you know. Again, we have the leading academic practices in the state of New Jersey, and Dr. Yang is one of the perfect examples of that academic practice coming actually to Hudson County. We're going to discuss everything from all the screening modalities, you know, what does it really mean, for example, when you get diagnosed with cancer, especially breast cancer, what do you want to know? The different types of breast cancers, the modalities, I mean, it's just going to be an endless bunch of information we're going to be able to offer.
What we need to do is break down what is such an incredibly scary and traumatic experience for most women, any woman who gets that diagnosis. We're going to see that Dr. Yang is very well trained and comes to us with a wealth of experience. So we're looking forward to talking to her. But it's also about what we do for breast screening and all the recent guidelines. She's going to talk about those, right?
Yeah. And again, it's not just surgery, you know, they have radiation, they have chemotherapy, they have immunotherapy, they have some of the latest treatments. And again, she's going to discuss with us some of the options that we have for the women in Hudson County, where you can go outside the conventional treatments, whether it's immunologic treatment, and maybe participate in some of the clinical trials that are going on that may be able to give you that extra edge and be able to give you that chance. And again, it's not just the individual, it's a patient-centered type treatment. In other words, when you get diagnosed with breast cancer, it's a comprehensive approach, but it's patient-centered. It's about you and specifically your cancer, which is something that she's going to discuss. You know, she's going to discuss about the different types of cancers, what implication it has, the different modalities for treatment, et cetera, et cetera. So I'm very excited actually to have her. I love her passion.
I agree with you. And you know, we will keep touching on the fact that even when you get treatment here in Hudson County, you are still part of the Cancer Institute of New Jersey, which is the only
Yep.
Comprehensive Cancer Institute in New Jersey. So having that linkage and then still being able to provide care for our population here in Hudson County is invaluable.
And again, being part of the academic practices, you know,
Yes.
common things happen commonly. And again, she's going to be discussing with us the importance of actually how important it is actually to get it early. You know, the early detection and the early diagnosis has a significant impact. And again, it's not just for the individual itself, it's the patient and their family, because this affects families as well. It's not just the patient. So
So, you know, a common thread we've had since we started this show together, Dr. Lazo, is health equity and people being able to access care. And unfortunately, we still have a lot of people not getting caught early. And really, we have these resources available to this community at all levels to make sure that this breast cancer is caught in time and is treated aggressively. And just that we have general health, women's health. We've talked about that.
and again, the different options, you know, once you get diagnosed, you know, what is your best option? And again, they use a comprehensive approach. You're talking about radiologists who specialize specifically in breast cancer, surgeons that specialize specifically in those modalities, et cetera, et cetera. So it's a very comprehensive approach that they give for cancer.
She's going to talk about how it's a journey, not a death sentence.
Yep.
You know, for cancer, it's so much in the news. You know, every time an important person gets cancer, it's talked about. But in the end, these are everyday women with a scary diagnosis, and it's important that we have here at home, without traveling, the best-in-class care. So that's something I'm very excited that she will be talking about.
And again, she's going to talk about, you know, how women really understand their bodies.
Yes.
You know, they really do.
Amen.
You know, yes.
Right.
And this is key, especially when it comes to breast cancer.
I think that agency to women understanding their own bodies, I think
correct.
medicine is finally getting to a
correct.
point where we're talking about that. And so very excited, of course.
Well, how about we take a quick break and we actually go ahead and bring her in?
Yes,
Because I'm dying to
we'll
talk
be
to
right
Dr.
back.
Yang. So we'll be right back after this break.
Jersey City Medical Center has a passion for heart health. We're Hudson County's only full-service heart hospital with innovative technologies and premier cardiovascular physicians, a partnership with Rutgers Health, the latest technology and medical advancements, and nationally renowned care for every heart in every community. Whoever your heart beats for, our hearts beat for you. Jersey City Medical Center.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and launch inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Hi, everyone, and welcome back to Hudson Health. My name is Dr. Angel Lazo, and I'm with RWJBarnabas Health at Exchange Place. I'm here with my co-host, Dr. Akunyili.
Welcome back. My name is Dr. Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a branch of RWJBarnabas Health. And it is a wonderful pleasure today to introduce one of our favorite people, Dr. Rebecca Yang, Chief of Breast Surgery at Jersey City Medical Center. Dr. Yang, tell us about yourself.
Thank you for that warm introduction. My name is Rebecca Yang, and I am the Director of Breast Surgery and the Comprehensive Breast Health Program here at Jersey City Medical Center. I am a fellowship-trained breast surgeon. I started my training at Princeton University. I went to University of Maryland for medical school, and then Case Western Reserve for my general surgery and breast surgery fellowship. I had the privilege of being the Director of Breast Surgery at Leahy Clinic for 15 years. And then I came down to New Jersey to be the program director for breast surgery at Overlook Medical Center, Summit, New Jersey. That was an opportunity for me to practice in a community setting. I then had this opportunity to join Jersey City Medical Center to help develop the Comprehensive Breast Health Program. It was my opportunity to return to an academic career where I'm very privileged to be part of an institution that's now affiliated with Rutgers Cancer Institute. We are the only NCI-designated institution in New Jersey which provides patients with access to the most up-to-date cancer therapy, treatment, and participation in national clinical trials. So my goal here is to bring comprehensive breast health care to the patients of Hudson County from the beginning of their walking into a breast imaging center to their diagnosis, treatment, and survivorship.
Very exciting, very exciting. Now tell us a little bit, because I do primary care, obviously, and it starts at the beginning for me. So let's delve into this, starting at the beginning, say, for example, with screening. Do self-screenings work, the guideline screenings? Talk to us a little bit about that.
The key for breast cancer survivorship and really the improved outcomes is screening. Studies have shown that screening reduces breast cancer death by 30%. And the only breast imaging study that has proven to be effective is screening mammography. And the guidelines currently are for any woman who has an average lifetime risk for breast cancer, which is 1 in 8, should start regular screening mammograms at age 40. And she should get them every year. Not every other year, not every 2 years, but once a year. And that is the key for catching breast cancer before you can feel it. If you can catch it before you can feel it, we've caught it early and your survival is excellent.
So that's very exciting, because a lot of women at home are wondering, well, do breast self-exams work? Do we still need to do that? Feel your breast under the shower once a month. What's the role of that in this model you described?
So we encourage women nowadays to be aware of their breast health. We don't recommend a monthly self-exam because that has not proven to improve breast cancer survival. It actually brings on more anxiety and it causes more unnecessary visits to the doctor. Women know their bodies best, so we say be aware of your breast health. And if there's something new or different that you feel, or just a symptom that concerns you, you should seek out, call your doctor, call your primary care provider. But we don't recommend, don't feel guilty if you don't do a monthly self-exam. It's more about being aware of your breast health, seeing your physician, and getting your screening mammograms when we recommend it.
So let's say you get diagnosed with breast cancer from your PCP. So what do you need to know? As a woman, what do you need to know about breast cancer? Right there, that moment, what should
So you should know that breast cancer is the most common cancer that women are diagnosed with in the U.S. And in fact, New Jersey has the #1 prevalence of breast cancer. You should know that it is not a death sentence anymore. There have been such advances in diagnosis and management that our goal is to cure you. But it is a road. You're about to start on a year-long journey, probably. And it's a multidisciplinary process. There are multiple physicians that work together to make the best plan for the patient to cure, with the goal is cure. But she needs to be referred to a center where there are people that are experts or trained in the management of women with breast cancer.
Just before we go on break, tell us more about this comprehensive breast center you're talking about. Who are all the specialists that are involved in this road to cure?
So nowadays, the success in management and diagnosis and management of breast cancer is what we call a multidisciplinary approach, where you have all the experts in one center. Comprehensive means that we have physicians that are dedicated to the diagnosis and management of women with breast cancer, which includes breast surgeons like myself, breast plastic surgeons who work with us to do the reconstruction, the breast medical oncologists who prescribe all the medicines that help women manage their breast cancer, breast radiation oncologists who provide radiation treatment to a lot of the women that need it. Then there's actually the breast radiologists who are experts in helping us plan the diagnosis and do the testing for the patients, like breast MRIs, PET scans. And then we actually have dedicated breast pathologists who do the analysis of the biopsies to make sure that we're giving them all the information. And that also includes not just the physicians, but all the support staff. Like we have an oncology nurse navigator who works with a woman the minute she's been diagnosed with breast cancer to help her navigate her journey. That includes not only helping her get her appointments, but if there's financial issues or transportation issues, she also guides these patients to our other services like social work support. We have integrative therapy, we have nutritionists. So it's really a comprehensive approach to helping a woman through her entire journey. because it's not just about the cancer, it's about everything else that she's part of.
Just incredible. We're going to go for a quick break, but we'll be right back. We want to talk about specifically some of the different type of breast cancers that I'm sure women are saying, well, what about my type? How does it affect? So we'll be right back.
I've got cancer.
We've got the highest level of cancer care,
the latest clinical trials,
researchers working to find a cure,
and nurse navigators to guide you every step of the way.
At New Jersey's only NCI-designated Comprehensive Cancer Center, your safety has always been our top priority.
I've got cancer, but I also have peace of mind.
Jersey City Medical Center and Rutgers Cancer Institute of New Jersey. Let's beat cancer together.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Welcome back to Hudson Health. My name is Dr. E.J. Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJBarnabas Health. I have with me my co-host.
Yeah, hi, I'm Dr. Angel Lazo, and I'm with RWJBarnabas Health at Exchange Place. And we're here today with Dr. Yang, and we're back. So Dr. Yang, let's talk a little bit about, because again, once you get your surgery, you got diagnosed, you got to recuperate. You're a former dancer. Tell us a little bit about some of the modalities, some of the things that you recommend to your patients, like the dance therapy.
So we used to think that just getting a woman through her breast cancer care was enough, but thankfully to the advances, women are living long lives, and we want them to get back to normal and not even think about that they actually had breast cancer. So a lot of women, when they have surgery, they lose a lot of range of motion in their arms, and they lose their overall physical sense and strength. So we find that movement therapy is very helpful in recovery. We like to start it even before they have their surgery to get them to kind of know some exercises and then advance them after surgery so they can really regain their sense of self and their body body image. Those include not only dance therapy, but physical therapy, art therapy, music therapy, all the different things that help a woman kind of get back to her own being, so to speak.
So I want to bring us back a little to the actual diagnosis. A lot of women are wondering about the phenomenon of dense breast. They may have gotten a note after their mammogram that they have dense breast. Like, what does that mean? Should a woman be worried? And what's the plan if you go for a mammogram and you have that diagnosis, and what should you do next?
So dense breasts or breast density describes the compositions of a woman's breast tissue. Breast is basically made up of breast tissue, which is like the active breast tissue, and fat. And so every woman has a different ratio. And half of the women in the world have what we call dense breasts, which means that half of their breast tissue looks white on a mammogram. So it's very hard to find subtle changes that may help you detect breast cancer early. So more than 10 years ago, I think Connecticut passed the first law, but in general, most states have a law that every woman who has a mammogram has to be informed of her breast density, because it can mean that they could benefit from adding ultrasound to screening as well, because ultrasound actually looks internally at the breast tissue to be able to tease out subtle changes or small things that a mammogram might miss. Having dense breast tissue also is a slight independent risk factor for getting breast cancer, because it's harder to find something, and plus there's just more breast tissue that has the potential to turn into breast cancer. However, women should not be alarmed. It's a very small risk, and because we can add ultrasound, that kind of takes away that issue. And also, we here at Jersey City Medical Center, and all our RWJBarnabas institutions have what we call three-dimensional screening mammograms. So three-dimensional mammograms are the most advanced technology. When we screen a woman's breast, it's creating a three-dimensional picture of her breast tissue. It's like getting a CAT scan of your breast. And it goes through 1 millimeter slices, so you can be very accurate. It's actually helped us catch breast cancer even earlier than we used to. So it's something that every woman needs to be educated about. And if her primary learns about this, they will always add a screening ultrasound to their plan as well.
And is this the same thing as fibrocystic breast disease?
Yeah, I mean, fibrocystic breast disease describes breast tissue that is generally more dense, but it also describes a phenomenon of just having more pain and cysts. So more women with dense breast tissue also sometimes are told that they have fibrocystic breast tissue.
So let's talk about the different type of cancers. Because I would assume, obviously, the modalities, the treatment, the prognosis, it differs. So
yes, there's two basic types of breast cancer. One is called non-invasive breast cancer, means that it's stuck in the breast. It can't travel, it's called stage 0. And then invasive breast cancer, which is the type of breast cancer that has the ability to travel. And that means that when we talk about management, that affects how we're going to treat the patient. And within that, we also are able to look at the type of breast cancer, specifically whether or not it feeds on estrogen, the female hormones, and another receptor called HER2. So we do an analysis of everyone's breast cancer to really individualize her care. If you have certain types of breast cancer, you may need an anti-estrogen pill, an anti-hormone pill. Certain other types of cancer may need chemotherapy. Another type of cancer that is called HER2 positive, you not only get chemotherapy, but you get antibody therapy, which is the most advanced type of treatment we have because it really targets the cancer cells. And another type of cancer, which is called triple negative, we now have immunotherapy. So each woman's cancer is unique to her. So when we meet a woman with a breast cancer, we look at her pathology report, and from that alone, we can kind of map out a plan for her because the treatment is so precise. So.
It's incredible that you have all this at Jersey City Medical Center for the Hudson County community.
Yep.
Well, we really, really appreciate you coming on board. And obviously, you know, we're going to ask you to come back in the near future.
My pleasure.
And tell you a little bit more about the program and how it's developing.
Absolutely. What a pleasure having you on the show. Thank you, Dr. Yang.
Thank you for having me.
We'll be right back.
Jersey City Medical Center is healing, enhancing, and investing in Hudson County because your heart doesn't beat just for you. So get it checked. When your bones are healthy, it lifts us all. We're delivering joy daily in our Lord Abbott Maternity Wing and providing New Jersey's only NCI-designated comprehensive cancer center. We'll continue building our medical network and taking every precaution for your safety so that we can all be healthy together.
Hi, everyone, and welcome back to Hudson Health. My name is Dr. Angel Lazo, and I'm with RWJBarnabas Health at Exchange Place. And I'm here with my co-host, Dr. Akunyili.
Welcome back, everybody. I'm Dr. Akunyili, Chief Medical Officer, Jersey City Medical Center, a facility of RWJBarnabas Health. What a treat it was to have Dr. Yang. Well, you do know we went to the same medical school, so that's my claim to fame.
Doesn't surprise me.
Well, thank you. She's just brilliant and so accomplished, but such a good, passionate advocate of health and access to a community.
And not just health, women's health.
Yes, and that's, I think so. I was very excited to hear when she talked about not just about her as being a breast surgeon, but really a comprehensive breast center with pathologists, radiologists, nutritionists, physical therapists, social workers, oncologists. That sort of wraparound services that any woman needs when she's diagnosed with cancer.
But again, I just loved her passion.
Yes.
You know, you can just see how she can really speak to the individual. She can really speak to a patient. She really drives home. It's a patient-centered approach, you know, to a very devastating disease and frightening disease for
It's not
everyone.
a death sentence.
No,
it's a
not.
journey. This is
That's
the beginning of a
correct.
journey where you were supported by all these professionals.
That's correct. But again, she emphasized, you know, the importance of listening to your body. You know, especially as a woman, you understand, and again, catching it early.
Getting yearly mammograms, and if you have a breast if you have dense breasts, knowing about that and getting ultrasound. Breast self-exams every month, not really in vogue anymore, it sounds like.
Right.
But
it's understandable.
Yeah.
Because honestly, women are in tune with their bodies.
Yes, if
so you
something's
don't need
different,
to pre-program this. I
see your
mean,
doctor.
you will pick it up. You know, you typically will pick it up. And women, thank God, have that tendency that they do not ignore it, you know, which is beautiful to see. So, but I love to see her passion. And especially talking about the different modalities that you can have, you know, the different type of breast cancer, whether you're estrogen receptor positive or not, what BRCA meant for you and your family. So, and it's just incredible that they have everything one-stop shopping.
And very individualized, right? So from the pathology report, looking at the slides of your biopsy and your tumor markers, and they actually do meet as a tumor board, as they call it. They can create an individualized plan. So there's no one size fits all, which is very exciting. And remember, we've said this many times, part of CINJ, which is the only comprehensive cancer center in New Jersey.
And again, the approach is not to tell the patients what they're going to get. It's to basically get them involved in their treatment. It's their options, you know, so we give them the option of what we would recommend for them, but they get to pick. You know, they really work with us to pick their treatments.
Well, I would say even from when I trained, medicine is moving towards a more shared decision model versus telling people what to do. But, you know, I was very interested. You did ask her about not just the cancer and the cancer treatment, but what comes afterwards.
Correct.
And then she talked about healing and therapy and dance and other modalities. Tell me about that. That was an interesting place to go.
She's very unique because she's former dance, so she's very much into dance. So she's incorporated that actually into her practice as far as disease and whatnot. So it's just fabulous to hear that. And again, it makes perfect sense. You're in tune with your body, both physically and mentally. Endorphins are flowing with exercise, and it gets you that better feeling.
Well, the key, we've heard it from really every doctor we've talked about, that movement, all kinds of movement, whether it's dance or yoga or physical therapy, anything that helps move and just put your body in a better place is probably also good for that disease state.
And again, the key is it is not a death sentence, you know. And again, it doesn't equal, for example, that you're necessarily going to get chemo and you're going to lose your hair, et cetera, et cetera. I mean, there's a lot of different modalities, but again, it's very fine-tuned to the very specific type of cancer that you have. And again, they put you in the driver's seat with the options of how best, and not just during the treatment, but then in the recuperation with every facet of it. So it's very exciting, actually.
And you know, this is, we just spent a lot of time last month talking about women's health, and I can tell you firsthand as a working woman mom that women tend to put everybody else first, but when it comes to screening and getting those annual exams, it's super important to go. And we have different hours at our comprehensive breast center to accommodate all schedules in terms of screening health.
I mean, as primary care, I basically got a lot of the so-called dense breasts and so on and so forth. So her explanation was amazing.
That's great.
I think we're definitely going to have her back.
Yeah, we do. We do have to have her back. Well, thank you. This was great. Dr. Yang was fantastic. And thank you all for joining us on this episode of Hudson Health.
We'll see you back next time.
Be well.
Take care.